The Lever. Subscriber-supported journalism that holds power accountable. As a Lever Premium subscriber, you'll get to hear exclusive bonus content from this episode and others in your feed. To become a subscriber, go to levernews.com.
From the Lever's reader-supported newsroom, this is Lever Time. I'm Arjun Singh. Yesterday, the Consumer Financial Protection Bureau proposed a sweeping rule that could eliminate $49 billion in medical debt from credit card reports. But Representative Ro Khanna wants to take things a step further. In a recent bill he introduced with Senators Bernie Sanders and Jeff Merkley, along with Representative Rashida Tlaib, he's calling for the wholesale elimination of medical debt. If signed into law, the bill could eliminate more than $200 billion in medical debt and alleviate the burden of more than 100 million Americans. But before it gets there, it'll need to get through a Republican-led House. And though the bill will dramatically change the lives of millions, will it really change the flaws of the healthcare system that led people to racking up so much debt in the first place? Today on Lever Time, I sit down with Ro Khanna to discuss his bill, why he thinks even conservative Republicans should get on board with it, and his thoughts on November's election. Representative Khanna, welcome back to Lever Time. How are you?
Great. Looking forward to our conversation.
Yeah, me too. So let's get right into it. I know that you and Senator Sanders, Bernie Sanders, you introduced a new bill calling for the cancellation of medical debt. Walk me through your plan, that bill, and how you propose doing that.
Well, this is such a huge issue. Someone breaks their bone or has an emergency. They go to the ER. They end up with $10,000, $20,000 of medical debt. If you, God forbid, have a serious condition, cancer, or heart disease, oftentimes you have 50, 100,000 of medical debt. In fact, almost half of cancer patients in this country have medical debt. Or if you just have a dental procedure sometimes and you need a new crown, you need a root canal, you go into debt. So what Bernie Sanders in my bill does is it says we're going to eliminate all medical debt. Here's how we do it. We give the hospitals a incentive to write it down. I mean, a lot of this debt has no value, and we say, look, you've got to write it down, not have debt collectors go after the debt. If people have already paid the debt and have credit card debt, then at one time there's a grant fund that pays off that credit card debt. And then going forward, we make it so that it is harder for hospitals to chase people for debt, that they need to not be charging people who are uninsured higher prices than those who are insured, that they need to be looking at all the programs that they can qualify for financial assistance before putting people in debt. And we have practices so that we don't have debt going forward. So it's a one-time forgiveness and then a reduction of debt going forward.
When you say that some of this debt has zero value, what exactly are you talking about? Because I know that a lot of debt is sold to these debt collection agencies. So does that debt just sort of disperse from, say, the hospital, for example, and become something that just goes out on the marketplace?
Yeah, I shouldn't say zero, but very, very little value, maybe 10, 15%, because it's so hard to collect. But even if it's hard to collect, it's destroying people's credit. It's creating enormous anxiety. It's hurting people's ability to buy a house. So it's hurting the people with the debt, but it's not like that the hospitals are saying, okay, we're going to get all of this debt. It's maybe 10, 15%. And then you've got these annoying debt collector companies that are trying to aggressively get it, who pay pennies on the dollar, but want to collect whatever they can. The bill also, by the way, bans debt collectors from calling and harassing any patient for past collections. So what this is actually going to do is forgive this debt, which is not a huge cost to the American taxpayer, because the debt, like I said, doesn't have the one-to-one value, but would provide huge relief for a lot of patients.
Now, for hospital systems, insurance companies, do you see them being a barrier to getting this bill passed? Has there been momentum on Capitol Hill behind it right now?
There has been a momentum. I mean, you even had Vice President Harris say, well, we're trying to do something to prevent debt from getting on people's credit scores. I do think you're going to have hospitals and some of the insurance companies lobby against it. Obviously, they are going to resist having the debt written off. But, this is probably not the hill they're going to die on. And they're much more opposed, unfortunately, to Medicare for All, which I support and is a long-term solution. And then you have even moderate Democrats who are supportive in general of getting rid of medical debt. So I think that this is something that can have not bipartisan appeal, unfortunately, but broad appeal within the Democratic Party. And remember, Bernie Sanders is the chair of the Health Committee, which it goes through. So that's why we took over a year and a half to craft it. It's done with a lot of details and could become law if we win re-election.
My understanding is that you went around and you heard stories from people about their experiences with medical debt. What were some of the more salient things that you had been hearing, and what were some of the more common experiences that you were hearing?
Arjun, I heard so many stories that broke my heart from folks at Our Revolution who we put together a town hall of folks with medical debt, to people who were in my office, to people I would just meet on travels. I heard one person whose mom had a stroke who was $700,000 in debt from her mother's stroke. I had another person who brought her bills into my office. It was a stack this high. I mean, for people who can't see the visual, a stack basically probably 15 inches just of bills based on a few days stay in a hospital. I had other people say that, they went into debt because the doctor they had to go see for their kid was out of network, and they didn't realize that. And that obviously no one's going to deny their kid the coverage and treatment that they need, and they ended up having to go into debt. So you just realize how much this affects people. And then here you have an illness you're dealing with in the family or yourself, and at the same time you're dealing with the economic stress of debt. And I believe in mental well-being and health, and that your mental well-being affects your health, and so you're adding stress at the worst time.
I think there are a lot of people who absolutely agree with that, and they have experienced it themselves. They've seen people experience it themselves, but some could look at this, and I think there have been some critiques about the idea of debt cancellation, which is this idea that, are we effectively still paying hospitals and insurance companies to continue to overcharge or provide very expensive healthcare, and that this is subsidizing them? And it's not to negate what is the good outcome of it, which is getting rid of people's debt, but what would you say to that kind of concern? Is this really just subsidizing hospitals and insurers overcharging for a lot of these things that got people into debt in the first place?
Well, it is the hospitals and some of the private insurance that is responsible for it. And you're right that there is that challenge. But the bill is pretty tough on hospitals. It says that they need to write down as much of the debt as they can to be continuing to get federal tax support. That they can't have debt collectors go after people. And they only are incentivized with some funding from the federal government if they meet those conditions of relying on old programs. For example, some states have laws saying you have to have this much percent for charity care, and many hospitals aren't compliant with that. So they would have to be in compliance with that. They'd have to not charge people more who are uninsured. They'd have to write some of the debt off, and then they can qualify for some assistance. Now, in terms of people who've had credit card debt, you're wiping off credit card debt that was way too high. And the real solution to this is Medicare for All. So every doctor is in network so that we can negotiate these prices. But we can't say, this money went to pay off insurance companies and hospitals with high executive compensation. So now we're just going to let Americans be stuck with the credit card bills. I mean, that's a cost that people shouldn't be stuck with, and that's why it's a one-time forgiveness of that.
For others, though, from the other side of the aisle who might say, well, this feels like socialism, the same way that you hear the debates about student loan debt and forgiveness, how do you square that circle for people like that who say, well, you should be able to pay your bills? We've known people who've gone to the hospital, they've been able to pay, or they get insurance. What would you say to them?
Well, I think healthcare actually is a bit less controversial than student loans. I mean, we have public school in this country. No one is arguing that you should have to take out loans to go to public school. There's an argument about college or vocational education and whether college should be free. I do believe it should, but there's a class argument there that some people make, which I've pushed back on. But there's more of a concern for giving student loans for college than there is on healthcare. Healthcare, very few people in this country believe that if you want to get treated for cancer or heart disease, that you should have to go into debt for it. And most people believe that in America, the wealthiest country in the world, you should be able to get healthcare without going into debt. So this is very different than other forms of debt. A lot of times you hear the argument, they're going to eliminate medical debt. So next, are they going to eliminate your car loans? Are they going to eliminate your housing mortgage? Are they going to eliminate all your credit card debt? And no one is saying that. Of course, if you want to buy a car, you got to be able to pay it. Of course, if you want to go take out a credit card debt to go to the Broadway show or to go to a sporting event, you got to pay it. Of course, if you want to buy a more expensive home, you got to pay it and pay your mortgage, so we can have assistance for first-time home buyers. This is saying a human right of healthcare, that you shouldn't have to go into debt for basic healthcare.
And I think something that should be said is that, a lot of these people, and I'd love to hear if these are similar to the stories that you've heard, a lot of people going through medical debt, actually, they're employed, they have insurance, and they face situations medically that for one reason or another, maybe their insurance provider won't cover the full cost, or there is an expensive treatment that they feel is necessary to pay extra for, and that is where the debt is coming from. Is that a trend that you notice as well, that people who do have insurance are the ones that are suffering from this?
Yeah. I mean, as I said earlier, half of cancer patients, have medical debt. And these are often people who are insured, but they're underinsured. The insurance isn't covering all of the procedures they need. The insurance isn't covering the doctors they may need to see or not in network. The insurance doesn't often cover all the medicines they may need. And who's going to compromise on treatment if you have cancer? So, the reality of this country, people often say, is why are we obsessed about just 10% of the country which may not have insurance? Well, first of all, it's a human right, and we should be obsessed if Americans don't have health insurance. But the issue of healthcare costs affects far more than just the uninsured. It's affecting the vast majority of Americans who, once they're faced with one of these healthcare costs, are shocked. And often, if they're living paycheck by paycheck or don't have big savings, end up in debt.
And I think that there's also the issue of this should hopefully not let people get scared to go to the hospital when they do suffer from an illness, or they may need to go because they want to get ahead of that, right?
You're absolutely right. I mean, so many people avoid getting the healthcare they need because of costs. One of the things the economists cite in opposition to Medicare for All is they say, quote unquote, utilization rates will go up. And that's just a fancy way of saying more people will go see a doctor if they know that they don't have exorbitant costs. Well, I have yet to meet someone, or very, very few people, maybe a hypochondriac, but the vast majority of people I know aren't excited about saying, I want to go see a doctor or a dentist. Let me really plan that appointment. I can't wait to go. It's not like going and eating at your favorite restaurant or going to a sporting event. People usually don't like going. So if they're going, there's a reason to go. And if the utilization rates are going up, that means people are getting the care they need. And by the way, there's probably a savings long term. So they're getting the intervention before they have a heart attack, before they have diabetes, before their cancer gets to a stage where it requires surgery or extraordinary intervention. So we want people to go to the doctor, and this makes it possible.
Moving outside of just medical debt, Representative, I think that when I had spoken earlier about kind of the straw man example of people who say, well, why should we cancel this debt? There is actually a lot of benefit that institutions and businesses can have from a more simplified healthcare system, but also one where their own employees are not potentially taking on mountains of debt. And moving, I guess, more to a broader example of, how we can reform the healthcare system. I know that you represent Silicon Valley. You represent some of the biggest companies in the country right now. When you talk to business leaders, do they also tell you that they think the healthcare system is just too complicated, unnecessary, and messy for them to be able to try to run their companies efficiently?
They do. They say they're not in the business of being healthcare CEOs. They're not running healthcare companies. They're running tech companies. They want to focus on that. They get 20, 30% of their payroll is on healthcare costs. It's the biggest barrier also to starting a new company, all the healthcare costs, or to becoming an entrepreneur. I mean, how are you going to be an entrepreneur if you're drowning in medical debt? And so what they want is to lower those costs. And by the way, they say that the whole reason for wage stagnation, why they can't pay more in wages to the most junior employees, is because that money is going in rising premiums. The money they would be giving for raises is going to the insurance companies. So these insurance companies have sucked out so much money from our country that should be in the pockets of working class Americans, and they have added so much burden to our companies in America that's made them less competitive with companies around the world.
Do you have a sense of how medical debt in the U.S. shapes up compared to other countries, or I should say countries comparable to the United States? Do other places deal with medical debt in the same way that we see it here in the U.S.?
No, because you don't have the situation where where you're uncovered and where you're accumulating debt. I mean, in most other Western democracies, there's some form of coverage, some payment if you can't afford to pay it. And it's not this sense that even if you're insured, that you're going to incur thousands of dollars. And so it's a uniquely American thing. It's uniquely American to incur hundreds of thousands of debt for student loans, and it's uniquely American to incur these thousands of dollars of debt for medical debt. And it's preventing people from having a basic, dignified life.
I try to stay on this podcast to policy and talking about that, but the reality is we have to work within the political system right now. Speaker of the House is Mike Johnson, a conservative Republican. What are the arguments that you're making to someone like Speaker Johnson or other Republicans to try and get this pushed at least through the House?
Well, Bernie Sanders was on the campaign trail in 2020, and he ran on Medicare for all and eliminating medical debt. He did a town hall on Fox News. And the biggest applause he got was when he talked about healthcare as a human right and everyone should have healthcare. Some of the reddest districts are also the districts that have the least healthcare, that have the least coverage, that have the most medical debt. This is a big problem in many rural communities and deindustrialized factory towns and places represented by Republicans. So my argument to Speaker Johnson is, even if you don't agree on Medicare for all, and I understand that that's something that you may not be for, let's at least get rid of the medical debt, and it's probably going to end up helping Republican districts, folks there, more than even Democratic districts. And so let's do this as something that we can come together on, that no one in America should go to debt to get health care.
Are there any Republicans right now who seem open to voting for this bill, at least getting it through the House and into the Senate?
There haven't been any co-sponsors yet, but there are people who have said, in principle, we agree there should not be medical debt. And so it's at least something that we can have a conversation with. But, largely this is probably going to have to be like the American Rescue Plan, like the Inflation Reduction Act, a vote that the Democrats undertake. And at least we don't have opposition to it so far within the Democratic Party.
Mm-hmm. Oh, so that's interesting. So within the party, this has been kind of a unanimous consent towards cancellation of medical debt?
There is definitely a much more consensus around this than there used to be. And Bernie and I have put together the boldest plan of canceling it, but you have others who are talking about it and saying, okay, we're open to some kind of plan. And that's why I think it's really possible to do this in a second Biden term.
What do you attribute the shift within the party towards being more open to cancellation of medical debt? I know just in the time that you've been in Congress.
Well, Bernie Sanders has 2 campaigns for president, and just a recognition that the working class is hurting in this country, that while wages are slowly going up, they haven't kept up with medical costs, and that a lot of families are drowning in medical costs and feel that the American dream has slipped away. And that's part of their anger, their bitterness at the system. And they see these big insurance companies, big pharma companies pouring millions of dollars into lobbying, and they're tired of it. And they want the Democratic Party to stand up for things that's going to give them a better life.
We're just a couple months away from the election. I'm sure you've been asked a bajillion times this, but I will also do my diligence as a member of the press and ask you as well. A lot of people are very concerned on the progressive Democratic side of the aisle that this might be a second Trump administration coming in. How do you feel about the tenor of the campaign right now, the temperature of the campaign? Do you feel confident? Do you feel worried? What do you think could happen in November, and why?
Well, it's going to be a very, very close election. It could go either way, but there are two things we need to do. One, we need to get the war to stop. I don't care what the polling says that Gaza is a 10th issue, 11th issue. I met so many people anecdotally for who they are deeply concerned about this. They want this war to end. They're the ones who knock on doors or on social media or organizers. We need that energy, not protesting us, but supporting us in 2024. And the second thing is we need to draw a clear contrast on a working class agenda with Donald Trump. We have to be the party that's going to eliminate medical debt, that's going to actually deliver on a minimum wage increase next time, that's going to make sure that we're capping rent so that it's not increasing past inflation at a time that rent is so high. That's actually going to implement universal child care to bring down child care costs. The average American family is paying too much, not just for food and fuel, but for these big ticket items, child care, health care, education. And we've got to say we're going to be the party that's laser focused on bringing those costs down for American families. Donald Trump's going to give tax breaks to the very wealthy.
Well, Representative Khanna, thanks for coming back to Lever Time. It was great to get to speak with you.
Arjun, thank you. Congrats on all the success of your podcast.
Thanks for listening to another episode of Lever Time. This episode was produced by me, Arjun Singh, with editing support from Joel Warner and Lucy Dean Stockton. Our theme music was composed by Nick Campbell. We'll be back later this week with another episode of Lever Time.